Drugs and Sex presents Hallucinogens. This podcast will focus on MDMA, commonly referred to as Ecstasy.
What are hallucinogens?
Hallucinogens are drugs that act through complex actions on the excitatory and inhibitory mechanisms in the central nervous system. Symptoms of hallucinogens cause alteration to the user's perception, thought, and mood, without causing damage to the memory or capability of the mind. How do they work?
Hallucinogens have an inhibitory and a disinhibitory effect. First, let's explain how the inhibitory effect works. Hallucinogens stimulate the serotonin 2A receptor. This means they mimic the neurotransmitter serotonin binding to the 2A receptor. They alter the receptor's shape, influencing the neuron where the receptor is. Therefore, hallucinogens increase the excitability of the neuron that contains 2A receptors. Most of the neurons that are stimulated by hallucinogens are connected to inhibitory interneurons, causing the final effect of the neuron's excitation to be inhibitory. Consequently, changes in consciousness caused by hallucinogens are due to a decrease in brain activity. Now, let's explore the disinhibitory effect. The disinhibitory effects of hallucinogens are specifically related with the creation of complex visual hallucinations. Hallucinations are related with the stimulation of the medial temporal lobe. Also, under hallucinogens, brain regions are less constrained, meaning they will not only perform their particular function, but they will operate freely. In other words, the brain has greater cognitive flexibility and interconnectedness between regions and functions. Additionally, a brain system, known as the default mode network, decreases its activity under hallucinogens. This system accounts for ego functions or self-reflection. Its decreased activity causes a sense of ego disintegration, meaning we are not self-conscious of our existence. What about MDMA?
MDMA, popularly known as ecstasy, inhibits the uptake of dopamine and serotonin, stimulating their release in the synapse. The entry of ecstasy to the cell causes levels of dopamine and serotonin to increase inside. It inhibits the monoamine oxidase, an enzyme that breaks dopamine and serotonin. Therefore, more dopamine and serotonin are available. MDMA may also boost their other neurotransmitters such as noradrenaline, acetylcholine, and histamine.
So how can MDMA alter sexual function?
Ecstasy typically has a larger effect on the promotion of closeness and increased sensuality between users that increase sexual activity. Ecstasy is commonly used as a party drug at raves or chemsex parties. Since it's most often used as a party drug and it has a low addiction potential, the long-term effects on a sexual function are still not completely clear. In one study, more than half of the participants reported some enhancement in sexual function, such as increase in sexual desire, sex organ sensitivity, body sensitivity, sexual intensity, length of sexual interaction, sexual enjoyment, or orgasm intensity. But 46.7% of participants reported some sort of sexual dysfunction when using ecstasy, with males reporting dysfunction more commonly than females. Reports of sexual dysfunction in males included difficulty achieving or maintaining an erection, and in females, dysfunction was described as experiences of vaginal dryness.
The likelihood of enhanced experience in sexual activity is dependent on the dose of the drug consumed. At low doses, the majority of the users experience euphoric effects due to stimulation of neurotransmitters causing increased levels of dopamine. These euphoric effects typically include feelings of attractiveness and closeness, boosted confidence, as well as higher levels of energy and endurance. While experiencing the drug's euphoric effects, the feelings of sexual activity and functioning may become enhanced. At high doses, MDMA causes hallucinations, which may be partially responsible for the reported dysphoric effects, such as anxiety, loss of control over thoughts, too much energy, and increased skepticism. Because of these dysphoric effects, it is more likely that the individual is unable to focus on the sexual interaction and adequately perform. So, how does MDMA promote unsafe sex?
There are few studies relating MDMA and risky sexual behaviors. Interviews to ecstasy users show that most of them have unprotected sex during MDMA episodes. Participants that report to have taken MDMA in the last 12 months are more likely to report multiple partners. However, studies did not show if promiscuity was influenced by MDMA use or if it was already part of their lifestyle. In a study, participants that had consumed MDMA report to have engaged in sexual activities that puts them on risk of acquiring STIs. Some participants affirm that MDMA affects their choice of engaging with multiple partners. A reason might be because having multiple partners reinforces the sense of collective bond ecstasy consumers usually have. Even if condom use was rare during MDMA episodes, participants report even they are not under the influence of the drug, they do not use condoms. When asked why they do not, a participant mentions it's not to increase sexual desire, but to be more romantic. This works in accordance with the love environment in which people usually take ecstasy. It just suits the moment. The relationship of MDMA and sexual risk is difficult to identify because most users combine it with other drugs. For example, when comparing it with alcohol, some users claim ecstasy is more risky before it triggers more intense emotions, while others claim under ecstasy they feel more control of the situation than under the influence of alcohol. Moreover, research shows that men who have sex with men are one of the most vulnerable populations exposed to the sexual risk for consuming ecstasy. How common is the use of MDMA in sexual assault?
MDMA is not commonly used in sexual assault because it's not typically slipped into drinks because it has a vile taste. Also, it's difficult to state if there was consent or not according to the capability of the victim to say no and reject the approach. Nevertheless, MDMA can cause a state of stupefaction, causing the person to no longer be under conscious control. They might not be able to give consent because they are vulnerable to the sexual desires of their partner. Under MDMA, we are obsessed with sensations, so being touched by a stranger does not seem as bad. Now you know that MDMA can have effects on the user's sexual function and lead to risky sexual behaviors. It's important to remember what effects these drugs can have on your body and to educate yourself before you consider using them.
Thanks for listening to our podcast on hallucinogens. If you missed our last podcast on cocaine and amphetamines, check out the link in the description below.